Hi, my name is James Monti. I'm the Associate Medical Director at the Anderson Emergency Center, which is the teaching trauma, Level 1 Trauma Center for Brown University in Rhode Island, and also the Director of the Advanced Practice Providers. Our group, the name of our group is now Brown Emergency Physicians, Emergency Medicine Physicians, and we supply the staffing for 4 different emergency departments within the state of Rhode Island. Obviously, it's the Anderson Emergency Center, which is a Level 1 trauma center. We also have the Miriam Hospital, which is another academic hospital that probably sees about 70,000 patients a year. The Anderson sees about 105,000 patients a year. We have Newport Hospital, which is truly a clinical, a community hospital, which sees about 32,000 patients a year. And then we have Hasbro Children's Hospital, which sees about 55,000 patients a year. And with that, we have 52 emergency medicine residents and approximately 110 attendings, I think, at this point. And I'm going to try and get through this real quick so you guys can ask questions as we go along here. Our program, in our APP program, we have currently right now 44 full-time advanced practice providers, and then we have an additional 17 per diem advanced practice providers. And they work at all the different sites here. I don't know which... So they work at all different sites for us, and they do all different things in all different areas. So currently at our Anderson Emergency Center, they would be found in critical care. They'd be found in the urgent areas. They would be found in the fast track. They would be found in the vertical area. And they also assist with psych and substance use patients as well. And so they function everywhere, and they function basically like a resident in many of these areas as well. Okay, let me just, so as far as the... yeah, that's all right. I got it here. So they all work directly with one another as far as the residency goes. I can't. No, that's all right. They work directly with the residents as far as a team goes, and they will cover shifts for one another as far as that goes as well. So today is a Wednesday. So for instance, today the residents have their lectures today. So the APPs are covering all their shifts. If there's an event or there's a graduation, the APPs will cover the resident shifts at that point in time. And overall, there's a very good relationship between our APPs and our residents. As far as the education for our APPs, currently they get a bi-monthly education where a specialist will come and talk to them. And tomorrow we have someone from orthopedics coming to talk to them to give them insight on how to do arthrocentesis. And we've had dentists and podiatry, all different kinds of specialists come to talk about what we see on an everyday basis, and it's very helpful in their education. As far as we also get supervision of them as well by we get surveys from our attending physicians who will let us know if there's issues with something going on. These get sent out 3 or 4 times a week to attendings who are working with them, and I get plenty of input as far as how they're doing. The thing that I really wanted to talk about here is our Emergency Medicine Physician Extender Development Program. So in our center, we do not hire new graduates. So in order for us to have new graduates, we developed a program where it's a residency for 12 months typically. And over the years, we've had 36, since 2011, 36 providers have graduated from that program. And of those 36 providers, we currently still have 24 still working for us as part of our APP group. So it's been a great program for us in order to kind of fill all the slots that we need for people who work with us. And it's really been a benefit to us as far as to know what people can do and can't do. And as far as we get roughly 4 to 6 of them a year. And then our team is by myself. I'm obviously the APP director. We have a chief advanced practice provider. We have an MPAD program director, and then we have 2 lead educators. And the advantage for them, these others, to do this is by they get time off their clinical time to partake in the education of the MPADs as far as that goes. So each one of the people that are involved in this are getting some benefit to as far as from an academic standpoint to provide education to the APP residents. So again, it's a 12-month program. It starts each year in September because it's hard to get people, once they have graduated from school, either nurse practitioner or PA, then they have to pass their boards. then they have to get credentialed. Credentialing at our hospitals takes roughly like 2 to 3 months, so you really can't get them up and going until September, that we've found. And they start out as just shadowing one of our lead or senior APPs, and then as time goes along, they're an extra, doing a shift as an extra person, and then they start doing solo shifts along the time. Their salaries are about 70% of our full-time APPs, and they work 32 hours a week clinical time, and they get 8 hours of didactics. On Wednesdays is when they get the didactics with our EM residency. So they have 5 hours of EM didactics on Wednesdays, and afterwards they'll have 2 to 3 hours of special workshops that will do either lacerations, different procedures. They also get BLS, ACLS, and ATLS training as well. They do rotations in radiology, ultrasound, psychiatry, critical care and trauma, medical simulation and observational unit. Obviously, they go through EKG interpretation, central lines, slit lamps, all those kinds of procedures. So the real thing that I found is an advantage to us for this is that, again, it's almost like an engagement that I can say. We get to meet them, they get to meet us. When they first come out of school, I find that they're really not ready to get in there and see patients efficiently, and that you can really trust their judgment of what's going on. So we both get to meet one another, and then we kind of figure out, do you fit with us, and do we fit for you? And that kind of shows in the amount of people that have stayed that it's worked for us as far as that goes. As far as the other thing that we've done is we've catered to each one of the MPAD's needs. So some people are really advanced and they don't need the 12 months. And so they can come out 10 months in or something like that and start help supplementing our group. Other people need more time. And so if they're willing to give us the time to stay and train, then we're willing to spend that time to invest in them. And most of those people that we've done that with are still with us. And so it's kind of been a win-win for both sides. So I really believe that this training program has helped us a great deal. You already have the resources there in the emergency medicine residency program, so everything's there that you really need to do it. And it does give you a constant flow of well-trained providers that can stay ahead of attrition.